The Wellness Hour. An in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, we're talking about CoolSculpting. It's a new technique that may replace liposuction that literally kills the fat cells, and your body just eliminates those fat cells, and you could get a flat stomach if you have a bump or bulge. Well, with us, we have a board-certified general surgeon and cosmetic surgeon from Beverly Hills, Dr. Forouzanpour. Dr. Forouzanpour, welcome to the program.
Thank you. How are you?
Before we get into this topic, CoolSculpting, Zeltiq, hot topic, tell us about your practice for people that don't know you. I mean, who's your typical patient? What are the procedures that you do?
My typical patients are females. Age group of 20 to about 45, basically compose about 80% of my practice, and the remainder of the age group of 45 to 65. I do a lot of body work, do a lot of breast surgery, a lot of abdominoplasties, liposuction, and body contouring. And I've been in practice for about 12 years in Beverly Hills. 12
years, okay. Now, this CoolSculpting, I guess it's called either Zeltiq or CoolSculpting. You know, how does it work? What is it? And who's a candidate?
The device is a great machine that works on fat cells only. There's a chamber that we place over the area that we're concerned, and we want to get rid of the fat in that portion of the body. It sucks in the fat and the skin into this chamber. For 1 hour, it reduces the temperature of the tissue to the point that only affects the fat cells, not the skin, not the muscle, not the nerves. And over that 1 hour period, the fat globules inside the fat cells form ice crystals. And that causes damage into the cell. Over the next 6, 8 to 10 weeks after the procedure, your body immune system goes in that area, gets rid of the damaged cells slowly by itself, and you see a reduction in the fat content in
So
that
does
region.
it eliminate the fat?
The machine...
I mean, is it like lipo in the way where the fat cells that are targeted, once they're gone, they don't come back? Is that true?
Yes and no.
Okay.
If you are not watching your diet and you're not exercising, you can form new fat cells in the area.
Okay.
And you can have the fat cells that are remaining increase in size and get fatter, and you'll still see the bulge that you had before come back. But the machine, unlike liposuction where we actually manually remove the fat cells, does not remove the fat cells by itself. It damages the fat cells to become defective, quote unquote. Your immune system goes in that area and picks up the cells that are not normal and eliminates it out slowly by itself. So in other words, we're not removing the fat cells right away. It's a slow process. That's why it takes a few weeks for the body to eliminate the fat that is.
Is this becoming a popular procedure in your practice?
It's extremely popular. We've had the machine for about 1 year. I was the first one that had it done.
Was that right?
The machine came to my office. I was the guinea pig in my office. I like to try things that are out there for myself, make sure that it works. And so when
does it work?
It did work great. And when they ask how does it feel, I have a way to tell them that, you know what, I had it done and this is how it felt. It's been a great number of increase in our emails inquiring about the machine, consultations.
What are they calling it, by the way? Are they calling it like freezing the fat cells off? Are they calling it CoolSculpting? I mean, what do they call it when they call?
It started Zeltiq first. And the company is trying to get away from the name Zeltiq and use the CoolSculpting, which was the second name they had when they came out of the market, as their name that they want to be known for.
Okay.
So when we have patient calling, they ask for Zeltiq, they ask for fat freezing procedure, they ask for the CoolSculpting. We've had a number of ways of describing.
You know, going into this interview, very skeptical about this CoolSculpting. Sounded like a gimmick, but it is no gimmick. You're saying, I mean, it actually works.
It actually works.
Okay. Were you skeptical? Because it hasn't been out since like 09 or something like that.
In 09, in U.S.
The U.S.
It was in Europe. Like every other good device that European countries and South Americans get it first, and then we get it afterwards. It had been studied in Europe. All the research was done before 09 release, and they've seen great results in the number of patients that they tried it on. Since it's been in U.S., the number of patients that we've tried, we've seen great results. On my website, we have a clip where the E-News came to my office. We selected a patient. They filmed it when we did the procedure, and they came back 6 weeks later, and they filmed it again, and they saw the difference. And they actually have their before and afters on the news clip that was released by the E! channel. So you can actually see a great difference. In that particular patient, she lost about 1 3/4 inches. in her waistline.
Have the patients been happy, by the way? What are they saying? I mean, your patients in particular, after it's done.
Majority of patients are happy where they see, you know what, I can see myself better in clothes. The clothes fit better on me. I don't have the bulge anymore. You don't see the great result that you like right away if you're someone who's patient.
Why is that?
Because it takes that long of a time, 6 to 8, sometimes 10 weeks, for the body to eliminate the fat cells. It's not an immediate change and reduction in the fat. The body takes a while to remove the damaged tissue.
It's a lot less expensive than liposuction and these other procedures.
Absolutely.
Is that correct? It's a lot less.
Absolutely. It's not just the cost of the surgery that makes a difference. It's the post-operative also. With liposuction, you do have some downtime. You have to take time off from work. There's a discomfort involved. You will have to have some anesthesia to be able to tolerate the procedure. With this machine, you do it today, back to work tomorrow. You don't have to take any time off from work. You don't have to worry about any side effects that you will have with liposuction, such as bruising, swelling, and whatnot. When I had it done, it was a Friday at 2 o'clock. When we had the demo come into the office, I went to a party Friday night. So it was that easy. True, there was a little bit of a discomfort, a little bit of a tingling from the procedure, but not to the point that prevented me to go outside and continue with my routine.
Who's the ideal candidate for this CoolSculpting?
Ideal candidate is somebody who's watching their diet, knows how to exercise, and already have a great shape, but just have some problem areas that cannot get rid of. In other words, they work out well, they got rid of most of the fat, but they have a little bit of a love handle, a little bit of pouch on the stomach that they can't get rid of normally, but if they've been doing. This machine works very well because it removes that stubborn or resilient fat that cannot go away by itself.
Okay, so what are the different areas of the body that you're treating with this?
As I mentioned earlier, there's a chamber that we place over the area of the fat. The chamber has 3 different sizes. There are 3 different chambers. If there's enough laxity in the skin and the fat can be sucked into the chamber, that's a great area to work on. Stomach area, upper or lower abdomen, love handles, for example, inner thighs. Most of the patients come in and ask for the chin. The chamber does not fit over that area yet.
What about the arms?
The arms is another tricky area because the chamber it's fairly rigid. It doesn't contour to the back of the arm well enough, and most of the clients we get don't have enough fat laxity or skin laxity for it to be pulled into the chamber. Once the tissue goes in there, you have to form a vacuum seal for that fat freezing procedure to continue. And if you don't have enough tissue to go in there to form the seal, it's just not going to be effective.
Okay, so abdomen, love handle, muffin top area.
Muffin top, what we call back boobs, which is the bra line for the ladies in the back.
Is that right?
Inner thighs works fairly well too.
Okay, now so take me through the process. Okay, so a patient goes in there, what can they expect?
Well, basically we place them in a procedure table, make sure that they're comfortable because they have to be in that position for 1 hour.
Okay.
And basically, the machine is turned on, it's already ready to go. We place the handpiece on the area after we place a gel pad, which protects the skin from getting frostbite or any skin damage. And the tissue gets pulled in to the chamber by the suction that the machine generates. And then once we know that the handpiece is stable and the patient is comfortable enough, we turn the freezing button on, and basically there are 2 cooling plates inside the chambers and brings the temperature down to the preset temperature that the company has done years of research on that affects the fat cells only. And for 1 hour, they stay in that position. In my office, we have TV and a selection of my favorite movies, and they sit down and watch a movie. They want to bring their own book, a laptop, iPad, whatever they want to do for that 1 hour, for that area.
Yeah.
They can do basically their business.
Do they do multiple treatments in one day? I guess, okay, so I understand this correctly. So for abdomen, the machine hits an area, and then do they do another hour on another area, or do they come back another day? How does that work?
You figure it out. Depends on your schedule. Okay. We've had clients that came in. I had one particular client came from Northern California because the machine was not available up there yet. She came in, she wanted to do 6 areas. So she was in my office. We planned it for 6 hours for her to be there. We did 6 different areas. You can only do 1 area at a time. The machine does not have multiple hand pieces. So if, let's say you have only time for 2 areas today, we do 2 areas. We come back tomorrow, the next
Is
day,
that
and we do
right?
another 2 areas.
So they can do this over a lunchtime if it's a long lunch.
Absolutely.
Is it painful? I mean, what do they say?
It's not painful. It depends on your pain tolerance. It's a very tight suction. It feels uncomfortable for the first few minutes when the tissue gets pulled into the chamber or the handpiece. And once the skin becomes numb because of the cooling, you don't feel the discomfort anymore. When I had it done, it was uncomfortable for a short while because, you know, what I call it's a giant hickey, literally, because you pull the tissue in there. It's a very tight suction. If you are able to tolerate that first few minutes, after that, it's just a bit.
You do traditional liposuction, is that
Yes, I
correct?
do. Correct.
What do you like this for? I mean, at what point is somebody not a candidate for lipo and they're a great candidate for this?
There are 2 different types of clients, one for the liposuction and one for CoolSculpting. Liposuction works for someone who has a lot more fat and they're looking to have a lot more result faster. With the liposuction, we can actually remove the fat, and within a week or so, you'll see the change. And they don't mind having the anesthesia or the recovery, and they don't mind to be a little bit of discomfort after the procedure. The CoolSculpting device is for someone who doesn't have the time to take off from work, from families. If you have a couple of kids that you have to take care of at home, with the liposuction, you'll have some discomfort. You will not be able to do your normal routine activities at home. With the CoolSculpting, you don't. You do it, as I said, you're back to normal life within an hour you get home, and there's really no downtime, no discomfort.
Now, your colleagues, okay, your other surgeon friends, because I called a dermatologist friend of mine, and I said, what do you think about this new CoolSculpting? Do you think it works? Is it effective? She goes, I don't know that much about it. I don't know. You know, she goes, I don't want to offer something in my practice that doesn't get great results because the patients aren't going to be happy.
Correct.
So when your friends, because you've been doing it a year, when your friends pose that question to you, hey, what do you think? Think I should get this? What do you tell them? And do they ask you that question?
Absolutely. I hear that all the time. The machine works.
Okay.
The only thing that the machine does that is you get about 20 to 30% reduction in the fat content in that area. That's the best we can give you. If you're looking for more result, in other words, more fat reduction, either you have to repeat the treatments after 10 weeks in the same area, multiple treatments in the same spot, or we go with the liposuction. If you're someone who doesn't want to have to come back for repeated treatments, you want to have just one treatment done and get rid of as much fat as possible, liposuction may be a better option. But with the Zeltique or CoolSculpting, 20 to 30% is average what we see. And if you want more than that, as I said, this may not be the machine for you.
Okay.
However, the other benefits from it, as I mentioned, no downtime. A lot of clients that we've had, they were great candidates for liposuction, but they were afraid of anesthesia. They did not want to go under anesthesia, so this machine works very well for them because they're awake, they're talking.
So they're awake during the
Absolutely, as I mentioned
watching one of your favorite movies.
If they want to bring their own movie, they can bring it, but
Okay.
I have a selection of some classics, comedies and all that. Yeah, they watch movies, they
I'll give you a DVD of my show that you can put
there
in your
you go.
office.
I'll put
They
it
can
out.
watch
I'll
my
give it
show.
as a selection, absolutely.
But okay, so any misconceptions out there about this that are out there that maybe you want to lay to rest? And also, second part of that, which may be the same thing, what are the frequently asked questions that every patient wants to know on the consult?
Clients come in and they think this machine works for every area. And as I mentioned, chin is not one of those areas that we can work on. And we've had a lot of clients come in and ask for that. You know, I want to get rid of my turkey neck. Arm is another area that we get frequently asked about. Those are the misconceptions that people have.
Okay.
That it works on everywhere on the body. It doesn't. There are selective areas that we can use it on right now. The company is working on some new handpieces or adapters that make it more adaptable to certain other areas, but right now, the areas that we mentioned earlier is what we can use it for.
Okay, and on the consult, what do they want to? They just want to know what areas of the body and does it work. So when doctors will watch this interview, okay.
Sure.
What do you want them to know? I mean, they're going to have questions. So it works.
Don't get it. I won't be the only one to have it in the office. So don't get it.
So, you know, I interviewed a guy. I talked to a guy about this Zeltique or CoolSculpting, and he said, you know, Randy, liposuction is still the #1 procedure.
Correct.
He said in the next 3 years, his prediction was this will be the new #1 procedure. What are your thoughts?
I wouldn't doubt it because
Really?
again, it works very well for selective areas and targeting the areas that are difficult to get rid of for patients who don't have the time to take away from work. as we're all getting more busy in our lives, we really don't have time to stay home to recover. This is a great machine. And with the past few years where we had some economic changes, people are going, or clients are going for more non-invasive procedures, quick fixes, and this is one of those devices.
What's wrong with diet and exercise? Somebody could argue, well, you know what, go to the gym, do sit-ups, eat right.
You know what? Absolutely nothing wrong with that. We do encourage you to do it after the Zeltiq or CoolSculpting procedure, because this does not prevent you from gaining weight later on.
Okay.
Neither does liposuction. Liposuction is not meant to be for weight reduction. It's supposed to be for resculpturing, getting rid of the areas that you cannot normally do with exercise and diet. Same thing with this device. You need to exercise, you need to eat right, but if you don't, it will come back in the same areas that you treated and the other areas.
Do you have patients that do one area, they wait for the time, a couple months, they come back and do a second?
I've had a couple of clients that they were a little skeptical and they weren't sure if it's going to work or not. So they say, let me try it on my abdomen first and see how it does. And then I'll come back for other areas. And they've done it and they saw great results and came back. And I think not only they want to see if it works, they want to feel like if it's uncomfortable, what it feels like, and just get the feel for the procedure.
What about your staff? They want to do it?
I've had a couple of them treated, yes.
What do they think?
They loved it, and they want to do more areas.
I mean, if I worked in your office, it sounds like I'd want to do. How often could you do it? Could you do it a lot? Like every couple months, every 3 months?
Not in the same area.
Okay.
As we said earlier, you have to wait for the healing process and the removal of the fat that is damaged by the CoolSculpting complete, and then you treat that same area. Usually about 10 weeks to 12 weeks is what we require you to wait before you treat the same area, again with the CoolSculpting.
Okay, final message. Somebody, I guess, that they're not happy with the fat they have in their body. What do you say to them? Or because we have about 3 or 4 more minutes, is there anything we've left out? Anything you wanted to say about this technology that we haven't talked about?
No, I wish I had thought about it. I was part of the group that found this device, because it's a great machine. It works very well. And as we, it's something that I'm sure other companies try to mimic or at least come up with.
Are men coming in for this? Is it mostly women?
Yes, we do. Yes, we do. Men as well.
Real men?
Real men. Real men. And one of the other things that the type of clients that we get is not just females. We do get men or personal trainers. Again, they do all the good stuff. They eat right. They work out hard. They just have some problem areas that normal diet and exercise.
What about Hollywood? Is Hollywood looking at this?
We've had some celebrities come into the office.
Is that right?
Yeah. Again, it's quick fix. You do it.
You want to drop a few names? Anybody we know?
Unfortunately, we can't do that.
But there are people that we know.
Absolutely.
So Hollywood is doing CoolSculpting.
Absolutely. You come in, you get some of the procedures, done. There are areas that you're interested in.
Do you have a backdoor entrance for these celebs?
Most of them come without makeup. You won't even recognize them.
Oh, really?
But they do wear hats. They hide themselves pretty well if they have to.
Okay, good. I want to thank you for coming to the show. Very interesting. Good stuff. And they could find all this information on your website. And
my website is perfectself.com.
Okay.
And they can go in there and read about CoolSculpting. And
do you do the consults?
I do the consults, and I'm actually the one that does the procedures. In other words, I put the machine on the patient.
Okay, good. And what do you like most about it, by the way? If you had to say, I like this about it.
The effectiveness and the fact that when the procedure is going on, I can stand there and talk to the client. Unlike liposuction where they're asleep and I have no way to talk to.
Okay, good. Thanks again. You've been watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this interview again, you can go to our website at wellnesshour.com. You just put in CoolSculpting. If you could spell Dr. Forouzanpour's name, you could do it that way. But if you put it under CoolSculpting or CoolSculpting Beverly Hills or liposuction, we'll make sure he pops up. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.